How to balance hormones. Hormones are your body's chemical messengers. Produced in the endocrine glands, these powerful chemicals travel around your bloodstream, telling tissues and organs what to do. They help control many of your body's major processes, including metabolism and reproduction. When you have a hormonal imbalance, you have too much or too little of a certain hormone. Even tiny changes can have serious effects throughout your whole body. Think of hormones like a cake recipe. Too much or too little of any one ingredient affects the final product. While some hormone levels fluctuate throughout your lifetime and may just be a result of natural aging, other changes occur when your endocrine glands get the recipe wrong. Signs and symptoms of a hormonal imbalance. Your hormones play an integral role in your overall health. As a result, there's a broad range of signs or symptoms that could signal a hormonal imbalance. Your signs and symptoms will depend on which hormones or glands aren't working properly. Common hormonal conditions affecting both men and women could cause any of the following signs or symptoms. Weight gain, a hump of fat between the shoulders, unexplained and sometimes sudden weight loss, fatigue, muscle weakness, muscle aches, tenderness and stiffness, pain, stiffness or swelling in your joints, increased or decreased heart rate, sweating, increased sensitivity to cold or heat, constipation or more frequent bowel movements, frequent urination, increased thirst, increased hunger, decreased sex drive, depression, nervousness, anxiety or irritability, blurred vision, infertility, thinning of hair or fine brittle hair, dry skin, puffy face, rounded face, purple or pink stretch marks. Keep in mind that these symptoms are nonspecific, and having them doesn't necessarily mean that you have a hormonal imbalance. Causes of a hormonal imbalance. There are many possible causes of a hormonal imbalance. Causes differ depending on which hormones or glands are affected. Common causes of hormonal imbalance include hormone therapy, medications, cancer treatments such as chemotherapy, tumors, whether cancerous or benign, pituitary tumors, eating disorder, stress, injury, or trauma. While the conditions below may be initially caused by hormonal imbalances, having the conditions can also lead to further hormonal imbalances. Diabetes type 1 and type 2, diabetes insipidus, hypothyroidism or an underactive thyroid, hyperthyroidism or an overactive thyroid, hyperfunctioning thyroid nodules, thyroiditis, hypogonadism, Cushing syndrome or high levels of cortisol, congenital adrenal hyperplasia, which causes low levels of cortisol and aldosterone, and Addison's disease. How to balance hormones. For some people, making simple lifestyle changes can help restore levels of hormones. The following strategies may help. Number 1. Get enough sleep. Sleep is an important factor for hormonal balance. Sleep may be among the most important factors for hormonal balance. Levels of some hormones may rise and fall throughout the day in response to issues such as quality of sleep. According to a study in the International Journal of Endocrinology, the adverse effects of sleep disturbance on hormones may contribute to obesity, diabetes, and problems with appetite. Regularly getting a full, undisturbed night's rest may help the body regulate hormone levels. Number 2. Avoid too much light at night. Exposure to blue light, such as those from cell phones or computer screens, can disrupt the sleep cycle. The body responds to this light as if it were daylight and adjusts the hormones in response. Note that exposure to any bright artificial lighting at night may confuse the body, causing it to suppress the hormone melatonin, which can negatively affect many functions. Avoiding artificial lights may help regulate hormones and restore a natural circadian rhythm. Number 3. Manage stress. A study in the journal Experimental and Clinical Sciences points to a link between stress, the endocrine system, and hormone levels. The researchers argue that the link is strong, with even a low level of stress causing an endocrine response. Stress leads to an increase in adrenaline and cortisol. If levels of those hormones are too high, it can disrupt the overall balance and contribute to factors such as obesity, changes in mood, and even cardiovascular issues. For this reason, it is important to find ways to reduce stress. A study in the journal Psychoneuroendocrinology suggests that the simple act of listening to music reduces stress, especially if the person is intending to relax. Number 4. Exercise. The hormonal effects of regular exercise may prevent overeating. A study in the Journal of Sports Medicine notes that even short exercise sessions helps regulate hormones that control appetite. Also, as an article in BMJ Open Sport and Exercise Medicine points out, regular physical activity reduces the risk of insulin resistance, metabolic syndrome, and type 2 diabetes. Number 5. Avoid sugar. Findings reported in critical reviews in clinical laboratory sciences support the idea that sugar plays a role in issues such as metabolic disease and insulin resistance. While concrete evidence is still lacking, eliminating sugar from the diet may help keep levels of hormone, including insulin, in check. Some people avoid specific sugars. However, recent research in the Journal of Nutrition found that table sugar, high fructose corn syrup, and honey caused similar responses. A person may therefore benefit from avoiding all sugar rather than just specific types. Number 6. Eat healthful fats. Olive oil may balance a hormone that affects appetite and digestion. Healthful fats may help maintain a balance of hormones involved in appetite, metabolism, and feeling full. A study in the journal Nutrients suggests that medium-chain fatty acids, such as those found in coconut or red palm oils, may work to regulate the cells responsible for the body's response to insulin. Meanwhile, a study in the American Journal of Clinical Nutrition found that olive oil may balance levels of a hormone that regulates the appetite and stimulates the digestion of fat and protein. Separate research in the journal Peptides showed similar results. Number 7. Eat lots of fiber. Fiber may play an important role in gut health, and it may also help regulate hormones such as insulin. A study in the journal Obesity notes that some types of fiber work to balance levels of other hormones as well, which may help a person maintain a healthy weight. Number 8. Eat plenty of fatty fish. The high levels of fats in some fish can contribute to heart and digestive health and may also benefit the brain and central nervous system. As a study in Frontiers in Physiology indicates, eating a diet rich in oily fish may help prevent mood disorders such as depression and anxiety. In some cases, adding oily fish to the diet may contribute to treating the disorders. The omega-3s in fatty fish may play a particularly significant role in balancing mood, though fully understanding the link will require further research. Number 9. Avoid overeating. Regularly overeating may lead to metabolic issues in the long term, but a study in obesity found that even short-term overeating changes circulating levels of fats and increases oxidative stress. The researchers also point to an increase in ceramides, which are fat cells in the skin, noting that a significant increase may promote insulin resistance. They call for further research into this area. Number 10. Drink green tea. Green tea can boost metabolic health. Green tea is a generally healthful beverage containing antioxidants and compounds that boost metabolic health. A review in the American Journal of Clinical Nutrition points to a link between green tea and reduced fasting insulin levels. The antioxidants in the tea may also help manage oxidative stress. Number 11. Quit smoking tobacco. Tobacco smoke may disrupt levels of several hormones. For example, according to a study in the International Journal of General Medicine, the smoke may alter thyroid hormone levels, stimulate pituitary hormones, and even raise levels of steroid hormones such as cortisol, which is linked to stress. How to balance hormones for females. The following tips may help balance hormones in females. Be wary of dairy products. Dairy is an important source of nutrients for many people. However, females concerned about the levels of reproductive hormones may wish to use caution, especially before consuming cream or yogurt. A study in the Journal of Nutrition notes that eating dairy can reduce levels of some protective hormones. In addition, the authors point to an association between eating cream and yogurt and missing ovulation. The link isn't clear, and the researchers call for further studies. Consider supplements and alternative medicines. There is some evidence that alternative therapies or supplements may address some hormonal issues. For instance, a study in complementary therapies in medicine found that a Chinese herbal therapy routine resulted in doubled pregnancy rates compared to Western drug-based treatment among female participants with infertility. Another study in the Avicenna Journal of Phytomedicine reports that Nigella sativa, known as black seeds or fennel flower seeds, helped raise estrogen levels in an animal model. If studies in humans confirm these findings, the supplement may be beneficial for people going through menopause. How to balance hormones for males. The following tip may benefit males. Consider eliminating alcohol. While most doctors consider drinking small amounts to be consistent with a healthful diet, a study in the journal BMJ Open found that even modest alcohol consumption may disrupt hormone levels in young men. The researchers noted a connection between regular alcohol consumption and reduced sperm quality, as well as changes in testosterone levels. For males with concerns about hormone levels, it may be best to limit or eliminate alcohol consumption. Tips for children. The following may benefit children in particular. Cut back on processed carbohydrates. Sugars are not only the dietary culprit when it comes to insulin resistance. Processed carbohydrates such as white bread products and baked goods may also contribute to insulin resistance. A study in the journal Mediators of Inflammation found a link between diets high in refined carbohydrates and insulin resistance in children. Eliminating processed carbs may help reduce this risk. Takeaway: hormones affect a wide range of bodily functions, and even small imbalances can have significant consequences. For some people, making dietary and lifestyle changes can restore a healthy balance. The strategies in this article may help, but anyone concerned about their hormone levels should consult a physician. In the end, make sure to share your experiences with us, and don't forget to subscribe, share, and like.